Hello everyone, glad to see you again. In last lesson, we have learned the 4 acting directions of Chinese medicinal herbs, which are lifting, lowering, floating, and sinking, the meridian tropism of Chinese medicinal herbs, and toxicity of Chinese medicinal herbs. Today, we continue our study of application knowledge of Chinese medicinal herbs. In this section, we will learn the compatibility of Chinese medicinal herbs. Contraindication of Chinese medicinal herbs. Dosage and administration. Let's start one by one. Compatibility of Chinese medicinal herbs refers to the combination of more than 2 herbs due to clinical requirement and medicinal properties and actions. Chinese medicinal herbs may have complicated changes by combination. Some may reinforce or decrease their effects, moderate or eliminate their original toxic side effects, while others may produce toxicity and poor reactions. For example, Shigao with effect of clearing away heat and purging fire in combination with Xixin, which has the functions of relieving pain, can purge fire to relieve pain and treat toothache due to stomach fire. The relationship of compatibility of Chinese medicinal herbs was generalized by ancient physicians as 7 aspects, named Qi Qing, which means the 7 compatible relationships of Chinese medicinal herbs. They are singular application, mutual reinforcement, mutual assistance, mutual restraint, mutual detoxification, and mutual inhibition and incompatibility. Singular application. In the clinical practice, when disease pathogens is simple and light, we only use a single herb to treat disorder and fulfill its therapeutic treatment. And the singular application of one herb has the advantage that the property of the herb is simple and the target is clear. And when it is administered to the patient in a heavier dosage, in safety range, which will have a better effects. For example, Renshen is applied to the patient with collapse syndrome due to qi deficiency, manifested as shortness of breath, fatigue, feeble pulse. It is recommended to stew a thick decoction of single renshen in large amounts, which is called Du Shen Tang. Mutual reinforcement, that is, 2 or more ingredients with similar properties and effects are used in a combination to reinforce each other's action. For example, Daihuang and Mangxiao are applied together to purge heat. Taoren and Honghua are used together in invigorate the blood to remove the blood stasis. Mutual assistance. Chinese medicinal herbs are used in combination, in which one herb is taken as the dominant factors and the other as assistance to raise its therapeutic effects. Their properties or flavors are different, but they may have 1 or 2 similar functions. For example, Huangqi with effects of tonifying qi and promoting the flow of water can be combined with Fangji with the effects of promoting the flow of water. So, Fangji can help Huangqi to promote the flow of water. They are together to be applied in the edema due to spleen qi deficiency. Mutual restraint, that is a mutual restraining effect of different medicines to weaken or neutralize each other's harmfulness, such as toxicity or side effects. For example, the poisonous actions of banxia can be decreased by ginger, so we will say there's mutual restraint relationship between banxia and ginger. Mutual detoxification. One medicinal herb can relieve or remove toxic properties and side effects of the other. For example, ginger can relieve the poisonous action of banxia. We will say ginger can eliminate the side effects of banxia. Mutual restraint and mutual detoxification refers to the same thing, but in different expression. Mutual inhibition. One herb's function can be decreased, even eliminated, by the other when they are used together, such as 人参 and 来附子. 来附子 can decrease the tonification of key actions of 人参, so we will say there's a mutual inhibition between 人参 and 来附子. Incompatibility. Toxic reaction or side effects may result when two herbs are used together. For example, there are 18 incompatible herbs. 贝母, 半夏 are incompatible to 乌头. In clinical application of medicinal herbs, we should make the wide possible use of the two kinds of ingredients, with the relation of mutual reinforcement or mutual assistance to make full use of their coordinating actions to raise the therapeutic effects. Herbal medicine can not only produce actions of treating and preventing disorders, but also have the harmful effect to human beings. When learning medicinal properties, we should not only know their therapeutic effects, but also grasp their harmful actions produced after taken. For example, cool and cold Chinese medicinal herbs having the effect on cleaning away heat may be likely to damage young, and drastic herbs having effect on removing pathogenic factors may damage healthy qi. Tonics having the effect on invigorating healthy qi may linger the pathogenic factors. In a word, even coin has two sides. We should know the advantage and disadvantage of those medicinal herbs and avoid the unfavorable aspect on human body, which is essential to understand the contraindication of medicinal herbs. The contraindications are divided into caution and forbidden according to their degree. Some herbs are not suitable for some cases as for their medicinal natures, but when they are processed, combined with others, or given improvement of their administration, they can also be used. Besides, the contraindication in pregnant women and incompatibility should be known as well. Some medicinal herbs cannot be used together in a prescription, otherwise the toxic effect will be produced, harming the patient's health and even his life. That is the prescription incompatibility. In TCM, 18 herbs are believed to be incompatible in their actions if given in combination. Some medicinal herbs should be contraindicated or used with caution to pregnant women. Otherwise, side effects of damaging factors or inducing abortion or miscarriage may be brought. Contraindicated herbs in pregnancy involve poisonous medicinal herbs and drastic purgatives, such as 斑毛、蜈蚣、水银、砒霜、巴豆、水蛭, and so on. And some should be used cautiously when mainly included those for eliminating blood stasis and promoting T circulation. The purgatives are part of herbs warming the interior, such as 附子、牛膝、丹皮、枳实、红花、桃仁, and so on. As the dosage of a medicinal herb has direct relationship with its therapeutic effect, a medicinal herb and its level of effective dosage will not achieve desired results, but some of them are drastic or extremely poisonous, so their dosage must be used properly to get the best therapeutic effects, and meanwhile prevent patients from poisoning. The common administration of Chinese medicinal herbs may be oral taken and external use, while the common oral taking form is decoction, and other forms like pill, powder, soft extract, and one can be prepared for oral use too, while moxibustion, lotion, medicinal powder, eye drops are used externally. Steel utensils available are a clay pot or earthen jar. The water must be clean and without a peculiar smell. That's all. Thank you. I will see you in next class.